Welcome back. This is The Globe. Mental health is increasingly dominating discourse in all spheres of society as more people come out admitting their illnesses. Some of these disorders are misunderstood. A prevalent one is the borderline personality disorder, which allows one to feel misunderstood, fearing abandonment on an emotional roller coaster and often suicidal. Borderline personality disorder comes with symptoms that cause significant distress and unstable relationships for both those diagnosed and their families and loved ones. Up to 10% of BPP patients die by suicide, and at least 40% will make multiple attempts to take their own lives, while self-harming behaviour such as cutting is a common means to release their intense emotional pain. However, psychiatrist and South African Society of Psychiatrists member Dr. Aneshree Moodley says long-term therapy together with the right medication offers a lifeline for people living with borderline personality disorder. For more on this, we are now joined via Zoom by Dr. Aneshree Moodley, psychiatrist and member of the South African Society of Psychiatrists. Dr. Moodley, a very good evening to you. Thanks for joining us. Welcome to The Globe.
Good evening. Thank you very much for having us and helping us to raise awareness on this very pertinent topic.
Pertinent topic it is, and I'm actually glad that you've joined us this evening. And I would like you to share with us in greater detail what borderline personality disorder is and what the telltale signs are.
Thank you. So borderline personality disorder is a very complex psychiatric disorder that does, as you've mentioned, have an association with significant morbidity, as well as, unfortunately, sometimes mortality, up to 10%, as you said. And it's very important for us to grasp some sort of understanding and awareness of this disorder because it's characterized by a variety of symptoms and signs that overlap with common disorders such as depression. As you've mentioned, it is a personality disorder, which by that sort of concept means that this individual has a pervasive, disordered way in which they interpret, think of, and engage with the world around them, leading to a myriad of interpersonal problems, as seen in a disorder such as borderline personality. And as you've mentioned, the core features, in fact, according to the American Psychiatric Association, is instability in their mood or affect, instability in interpersonal relationships, and instability in self-image, as well as impulsivity. And in fact, according to our diagnostic criteria, this individual should have impulsivity seen in at least 2 out of 5 main areas. And when we refer to impulsivity, we're referring particularly to impulsive substance use such as alcohol and or other illicit substances, shopping, binge eating, reckless driving, and so forth. But one of the core features is the instability, specifically the mood instability. Now, these individuals have intensely reactive moods. So they have intense dysphoric episodes or irritable or anxious episodes that very characteristically last for a few hours and seldomly go on for a full day. This is what distinguishes borderline personality from a disorder such as bipolar. And I'm raising that specifically because bipolar mood disorder is one of the disorders that is commonly misdiagnosed or misinterpreted instead of borderline personality disorder. The other area of instability that I want to mention is the unstable interpersonal relationships. And these individuals have pervasive, disturbed ways of interacting with other individuals based on a real or imagined sense of abandonment or rejection. And this leads to a very erratic and very intense pattern of a complex pattern, I should say, of alternating between devaluing a relationship and idealizing a relationship. So those are the core clinical factors. I think I'll stop there and allow you to
Yeah.
ask me a little bit more.
Yeah, sure, because, there's plenty more questions with regards to this condition. I mean, the cause of BPD isn't fully understood, but would I be correct to suggest, Dr. Moodley, that a combination of biological and environmental factors, such as childhood trauma, for instance, play a role in the development of this condition?
Absolutely, you are spot on. Now, borderline personality disorder itself is a term that was coined way back in the 1950s. And back then, of course, our scientific methods of research hadn't yet advanced to what it is today. So largely, the theories of etiology back then, or causation, were psychodynamic or psychological. And we will touch on that because they are still relevant. However, in the last, I would say, 20 years, there has been significant progress being made. So there is now a large database available that does conclude, I should say, that there is genetic or heritable factors involved. So borderline personality certainly does have a genetic link. And in fact, I could go one step further and say that there is significant data linking genes that code for the HPA axis, or the hypothalamic pituitary axis, which is a very specific or particular axis in the brain that regulates moods and emotions. So the genes that code for that area might be deranged. Interestingly, there is a direct link between these genetic and biological factors and the environmental factors, because these genes, I should say, that code for the HPA axis may be altered by childhood maltreatment or abuse. And there is significant association between early childhood abuse or trauma and borderline personality. So we see a picture where everything becomes connected. So, yeah, absolutely. A definite mixture of environmental and genetic factors. Saying that, though, I would like to contextualize further to say that not all individuals who have survive childhood maltreatment or abuse of whatever form will go on to develop borderline personality. It is merely a risk factor. And also that there are individuals who may grow up in a reasonably healthy family environment that may develop borderline personality disorder.
Yeah, you just mentioned some of the risk factors. What are some of them? What are the risk factors of BPD? I mean, we understand that if a close relative has BPD or a similar condition, then the individual is at a much higher risk of developing the disorder. So what are the chances of it being hereditary?
So, as I said, there are strong genetic links. So, definitely having genetic factors would increase the likelihood of an individual developing borderline personality. However, the other psychological theories would be childhood maltreatment or abuse, as well as very interesting, I should say, and very complex theory around an invalidating childhood. So this is a very complex theory, and it can be somewhat controversial, but I do think it's worth touching on. So in other words, because borderline individuals have exquisite sensitivity to real or imagined interpersonal rejection, one of the theories is that this fear of abandonment or rejection lies rooted in childhood, where they may have experienced their emotions being invalidated, or they were not reassured adequately, or what would be adequate for that individual. So unstable parenting styles, or unstable attachment or bonding styles, or, a very disorganized household, or inconsistent caregiver figures or mothering figures, those sort of factors would increase the risk for such disorders such as borderline.
And how does one know if they live with the condition?
Well, I think one of the key features would be the unstable interpersonal relationships. So, struggling to maintain healthy relationships with those around you. And this disorder has onset in early adulthood. So, we're looking at 20s, if not even usually by adolescence. And the symptoms that we find should have existence in a variety of contexts. So, it's not just that you have conflictual relationships or poor relationships, for example, at work. This would be in a variety, so a diverse range of contexts at work, at home, your hobbies or social areas, from school, from studies, etc. So the one of the big things that problems that usually present, I should say, would be unstable or difficult interpersonal relationships. So people coming in with difficulties either in their romantic relationships or difficulties in their family relationships, as well as the intensely reactive mood that I described. So coming in saying, they feel at a loss, they feel overwhelmed because they themselves or loved ones have said to them, life for them feels like a roller coaster. It feels like you're moving from being euphoric the one moment to being irritable the next, and then 2 hours later being anxious. So feeling like their moods are very unstable and impacting on their interpersonal functioning as well as functioning at work or studies, etc. Another key area that brings patients in to see a doctor or psychologist is, of course, the areas of impulsivity that we described. So impulsive substance use or impulsive shopping or driving. So it might be a seemingly unrelated symptom, but upon deeper exploration and evaluation, once the clinician puts all the pieces of the puzzle, if I may say so, together, then we realize that the individual's got borderline personality.
And what's the danger then of people fearing to come out and talking about BPD and as well as bipolar disorder for fear of rejection, because we know that there's this stigma attached to bipolar and BPD because people fear that the social elements are coming into play. So how do people address that without being victimized, without being ridiculed?
Yes, very pertinent question, absolutely, to South Africans, but possibly to the entire global sort of population of people that live with borderline personality. I think in South Africa, especially, we do still have a very young sort of awareness of mental illness and openness to embracing mental illness in general. So there definitely is the fear of coming out and saying, listen, this is my disorder. I do have borderline personality. And I must also make a distinct comment that borderline personality is very different to bipolar disorder. Borderline personality can be associated with what we say comorbid disorders, so other co-occurring disorders, but borderline and bipolar are distinct disorders. But saying that, there is significant stigma attached to having a mental illness, especially one like borderline. What would help individuals to feel safer is an increased awareness, which I guess a program like yours is creating, as well as South Africans being able to adopt a more non-judgmental approach and realizing that mental illness is one of the leading causes of disability in the world and therefore is extremely common. So it's about time that we embrace mental illness and allow individuals that suffer with disorders such as borderline personality to come forward and seek help. And seeking help includes being able to derive some level of support from those around them, which would therefore involve disclosing their diagnosis of borderline personality. I would definitely implore loved ones to adopt a non-judgmental approach to support the individual in getting the correct help from a clinical psychologist or psychiatrist or adequately trained mental health practitioner to support the individual from to support the individual in getting the correct medications that may help them to regulate their symptoms, and support them in an everyday, life matters. At the same time, living with an individual, so living with a loved one who has borderline personality, can also be quite burdensome. As anyone can testify to living with a loved one with any mental disorder or any health issue in general. So therefore, we also encourage the loved ones to seek out support, be it from a social worker or be it from a professional.
And it's very important that we get as much information as possible for purposes of helping and supporting our loved ones and those who live around us who've got this particular condition. Dr. Moodley, great chatting to you. Thank you so much for your time.
You're welcome.